I'm interviewing Dr. Moore from Sam Houston State University. She also happens to be one of my former music therapy professors.
Yeah, so it's coming full circle.
Exactly. So just if you would like to introduce yourself, tell us a little bit about you.
Sure. I'm Carolyn Moore. As Jonathan said, I'm Program Director of Music Therapy at Sam Houston State University, and I've been here since 2015. Prior to that, I was a music therapist primarily in Florida, and I got to work in a lot of different clinical settings, including medical settings, rehabilitative, psychiatric, community settings, nursing settings, and just got an opportunity to wear a lot of different hats. And went to ended up going to graduate school in Florida as well, so staying there for quite a long period of time before I decided to make the move to Texas.
hmm Okay. So I'll start with the first question, which you kind of answered a little bit.
Yeah, that's okay.
What setting do you work in?
So currently, I'm not doing any clinical work that does not involve the university. So I'm primarily doing practicum supervision of undergraduate and master's students. So this semester is entirely telehealth, like many people. And so I would say the clinical setting is telehealth right now for us, but we're seeing anyone from young children, 3, 4, 5, 6 years old, all the way up to older adults. And the students that I supervise myself are working with groups of adults with disabilities who are live in the Houston area. We also are working with a group of children who are somehow affiliated with the university, either their parents are faculty members or their parents are students at SAM, so that's been really fun. And then we're also seeing a teenager with autism.
Okay. So how has the switch to telehealth this semester been practicum-wise compared to when I was there?
Well, there's been a few uh, just being really flexible has been the name of the game for our students who already have experience with in-person
hmm
practicum. This is a whole new ball game for them. They're already used to being in a clinical setting with somebody and having that energy exchange in a physical environment. And they're really having to make a lot of changes to how they interact with clients, to learn the technology, to learn Zoom's capabilities and how to create music that is of good quality and still has therapy value. And so for them, I think it's been a good practice in, flexibility and just being open to the possibility of therapeutic change and therapeutic opportunity over Zoom. And then for our students who are just starting practicum who didn't really know what to expect, they're just really happy to get started to actually have interaction with real life music therapy clients. So I think in some ways, since they don't have anything to base their experience on prior, they are just learning something new every day and really honing their observation skills and their musical skills. So I definitely think it's been a good experience, and understanding that telehealth will probably be a permanent part of the music therapy landscape forever now in some form or fashion. We're really happy that students are getting the opportunity to learn this new modality.
Yeah, I would say that it was also not incredibly stressful, but when it first happened, it was also kind of a stressful switch for me just because everything I learned back at SAM was very
Mm-hmm.
geared toward in-person treatment. So trying to find a way to adapt instruments for patients that didn't have instruments at home was a very
Yeah.
big challenge to overcome at first.
Well, and think about when we first started doing telehealth, and probably when you all did back in, maybe it was in March or April. That was
hmm
like, it was an emergency. It was like, okay, this is temporary, and we need to help our clients, and they really need us. So let's just figure out how to make it happen. And it was very stressful because we all had no idea what was going on in the world at that time. And now that it's become a little bit more like we've been able to figure out how to live with the limitations of the current public health environment, we're now not looking at it like it's emergency treatment and like it's just temporary, but we're seeing how to make it work like longer term. And for these students that are starting out, I worry the opposite. So you had all in person, and now you're learning how to translate that to remote. And these students might have a lot of remote, and then when they actually get in person with somebody, maybe next semester, maybe a year from now, it's going to be the opposite for them. How do I make this work in person now that I'm used to doing it remote? So I think it's definitely going to be challenging, but also rewarding because it's just forcing us to learn how to think in new and innovative ways.
Okay, so moving on to the second question, what made you pursue a career in music therapy?
I think my story is probably very similar to most people's in that I knew I loved music. I was a band nerd growing up. I took piano lessons. I played flute. I was in band and orchestra. My family is very musical, and I also knew that I wanted to pursue a career that was involved. I had some kind of helping relationship with other people. So, like many people, I'm sure I thought I invented music therapy in my head, and I was going to study music and psychology, and then somehow combine them. But I will say too that I did grow up in a family of people in helping careers or that were informal helpers. So I do have some therapists in my family, including my aunt Penny Dashinger, who was an art therapist. So I did grow up with some people who were helpers, but also my family on both sides are just naturally helpers informally, so very much involved in volunteer work and community involvement. And so I think I had people in my life who modeled what it meant to be a helper. And then also grew up in a family that very much valued art and music and drama and dance. So I think it made sense that I would want to pursue a career that combined both of those. Um, and then, my aunt, who was an art therapist, she died when I was pretty young, so I didn't know a whole lot about her. But as I became an adult and learned more about her and some of the work she did in art therapy when it was sort of first starting out in a similar manner to how music therapy was, I feel like even though I didn't know her growing up, that I somehow ended up kind of walking in her footsteps in a similar way. So, yeah.
That's really interesting.
Yeah.
Yeah, I feel like my venture into music therapy also started out the same way. I
Mm-hmm.
had like a love for psychology and then a love for music, but I knew that I didn't want to spend 8 years trying to get a psychology degree or spend
Yeah.
like a music degree getting a performance
Yeah. Well,
education.
and most of the time when I talk to prospective students, I think with the internet being as prolific as it is, most people come in with a much better idea of what music therapy is than I did when I was a freshman.
Mhm.
So a lot of people are coming in saying, I saw Megan Morrow on CNN working with Gabby Giffords, or I saw a spotlight about music therapy on the local news in Miami, and I saw, and I did more research and I saw what this actually looks like, and it just was something I thought would be really rewarding and also really challenging. So, I think that people's reasons for pursuing music therapy seem to be a little more specific than they were when I did my interview with my mentor at Montclair State, back in the early 2000s. But I think all of us come in, or most of us come in with, understanding we want to learn about other people, and we like, being around other people, and we love music too, and we think that there's some value in combining those two.
Mhm. So my next question leads perfectly into this. How do you explain music therapy to other people?
You know that this is a really hard question because there's so many ways you could define it. So I try to make it relatable to the context of where I'm speaking to that person. So the way I would explain music therapy to somebody in the elevator with me at the children's hospital was to explain it in the context of the hospital. What are these children here for? Some of them have illnesses, some of them are having surgery, and here are things that they're going through that I can help them with as a music therapist. Or um, at a school for children with autism locally, talking to parents, really explaining it to them, using the ways that we know how to explain it that make it relatable to them. So I always try to tell a story or give an example in order to explain it in a way that really makes it stick for that person. And that means I might explain it 25 different ways over the course of a week. And I think that that's okay too, because my own understanding of what music therapy is or can be has also evolved over time, and I'm realizing it can look or um, be applied in slightly different ways depending on the context too. So I don't know that there's one perfect way to explain it.
Yes, I always try to go by the definition that we got taught in class,
Mm-hmm.
but I also like to give examples because I'm frequently asked about it, especially down here where it's very rare compared to all the other forms of
Mm-hmm.
therapy that we have available.
Yeah, and the AMTA, or the like organizational definitions, that it's a difficult situation to be in, because that's the voice of music therapy in North America, or in the United States at least, and that's the definition that was sort of like the foundation. But for example, if I say non-musical goals, that might be very confusing to a client who's seeking out music therapy, for and needs lessons that are adapted, and thinks the music therapist is the right person for it, and really has musical goals for themselves in addition to maybe some other ones. Or the fact that a music therapy, I think the old definition, or one of the definitions I've seen, is it's a planned interaction. And sometimes I've had music therapy sessions that were not pre-planned, and just at the last minute, there was a reason why I had to run a session, and it ended up not being planned at all and being a really great session. So definitions are imperfect. They don't meet every scenario, but they're a good starting place. And I think AMTA has done a really good job trying to give us a definition that we could tell to somebody else and they'd get a pretty good idea of what we are trying to get across.
Mhm. So, what does your average day as a music therapy professor look like?
Oh, goodness. There is not really an average day. I would say my day is a combination of teaching, clinical supervision, um, some preparation and planning for classes and grading and things like that, and then also administrative things, and also hopefully time for some research or some projects. So, for example, on a Monday, which is a pretty typical day for me, I teach in the morning from 9 until about 11 o'clock. And then I have a few hours where I'll be meeting with students, or having other meetings, or working on research or grading. And then from 1 until about 3 o'clock, I supervise practicum students. So I'm actually in the sessions with them, and then supervising them after. And then I have another break for about an hour to work on all those other things that that aren't in the classroom. And then at 4 o'clock, we have practicum lab, which is a change from when you were at SAM. So now we do practicum lab Mondays at 4 and Wednesdays at 4. So on Mondays, generally all of us will meet together. All the students in a certain level of practicum will meet together for an hour and review different clinical skills or discuss our experiences. And so that's from about 4 until 5. And then ideally, I will turn everything off and go home, and then not do any work at home. But what usually happens is I'll go home, check emails for a little bit, maybe go over lesson plans for the next day, or do some work. And then the next day might be a little similar, might be different, but the puzzle pieces are the same. It's just maybe a different order.
Okay.
Yeah.
Would you say that your average day has changed since that you became the program director?
Yes. There's a lot more administrative things that the program director is involved with. So I do a lot more. I have a lot more meetings with our college. I go to meetings to learn information about administrative changes that impact financial aid or registration or graduation. So more of that kind of stuff. And I would say one of the roles of a program director is to keep up with educational trends, and also with our organization, to make sure that our curriculum is innovative and up to date. So we, not just myself, but the other faculty are spending a lot of time just looking at the curriculum, seeing where the needs are, how to fit everything in, what order to do things. So there's a lot more looking at more program specific kind of details and things like that. So it becomes a little challenging to find time to do it all, but ultimately it's really fun to be able to imagine what the program could look like or what changes we might want to make, and then actually go through the process to make it happen.
Okay. Also, in related to that question about what your average day is, how is supervision changed now that it's all like telehealth?
Well, we are able to record every single session we do now over Zoom, with, of course, with our clients' permission. And
Mhm.
so, and of course, we had some opportunities to record before, but we actually have the opportunity to go back, watch videos, and actually see, in basically in real time, every single person in that session. So I think we have opportunities to be more detailed and more nuanced in our observations, because I can go back and watch a Zoom video of my students and only focus on one student, or only focus on musical skills. But also, students can watch their own videos. So it's just another way to learn. So I think that's been a benefit, is really having the technology to do that. But a lot of supervision has been us as faculty learning together with students, because telehealth is new for all of us. I started doing telehealth over the summer in preparation for the fall, knowing I needed to learn a little bit, but also just for my own professional development. And so it's us working together in supervision to figure out the best way to facilitate an intervention, or how to set up the sound settings to make what we want to do sound the best. Just really workshopping through together different ways to make things work. So I think doing it over Zoom definitely has some benefits, but also, again, we're not in the same space in a room, so sometimes there are technological issues, like I'm sure you've experienced, lag time,
Yes.
internet connections being poor sound, our clients or the students not having adequate space for privacy, like all kinds of things, just
Mhm.
that we didn't have to think about so much in the classroom. So I think it's definitely become more of a working together to problem solve opportunity than it was before.
Okay. So for my next question, this would probably pertain to more around the time you spent before you became a professor.
Mm-hmm.
But did you ever get to collaborate with any other disciplines or professionals or any other form of therapies?
Yes. So my first job was at a forensic psychiatric hospital in Florida, and I think my favorite people to collaborate with were not other therapists, but actually the staff members. So the direct care staff, the people that were, running the units where the folks were living, they knew so much more about the clients sometimes than the therapist did, because they would spend 12 hours with them for their shifts. So I enjoyed getting to know them and learning about their perspectives. Also got to work with mental health advocates who they themselves were self-advocates. So they had come through the mental health system in Florida, were doing really well in recovery, and were hired by the hospital to kind of be peer mentors. So that was something I really enjoyed, is, working as colleagues with people who had firsthand experience, even being at that hospital as patients before. I've also had the great opportunity to collaborate, like at Miami Children's Hospital, it's now Nicholas Children's Hospital, with nurses who are absolute angels on earth, very patient, and also natural teachers. So I learned all kinds of things that just helped me understand what patients were going through, but also that helped me be a better music therapist. So one of my favorite nurses, Nurse Janine on the PICU at Nicholas Children's, taught me how she does every single thing, from an IV stick to a dressing change to how to remove a chest tube. I got to learn how she does all that, and what pain might be associated with it, or what the experience might be for the clients. And that helped me be a lot better at procedural support. So I really love working with the nurses. And I've had the opportunity also to work with therapists like speech language pathologists, occupational therapists, um, physical therapists, recreation therapists, just all kinds of people. And I think, you know, what's really fun is we get to help patients together, help clients together, and we all bring a little bit of something different within our own scope of practice. But it's really fun to collaborate and see how we can work together in a way that kind of provides a more synergistic way of addressing a therapeutic goal.
Yeah, we get to for like the team down here, we have our music therapist, we have our interns,
Mm-hmm.
we have a rec therapist, and we recently got a behavioral support therapist. So some of our clients get 2 different forms of therapy, some get all 3. So it's really nice to see like the difference across music therapy
Mm-hmm.
to rec to behavioral, and to see how like all those 3 different forms can like work together, because
Mm-hmm.
I definitely notice improvements with just music therapy goals
Mm-hmm.
based upon my clients
Oh
receiving a new
yeah.
therapy.
It makes me think of something I forgot to mention was when I lived in Miami for many years, I worked with a dance therapist, Sandra Beggs. We ran a group on Saturday mornings with a music therapist who owns a private practice. Her name's Jillian Mailer. And it was from 10 to noon every Saturday, and parents would drop their kids off. So they didn't stay the whole time. They'd go run errands or whatever. But we worked together for 2 or 3 years, and the collaboration was great because we both got to bring our own expertise and we really valued each other, but also just the relationship we developed among the 3 of us, our 2 music therapists and the dance therapist. Like Sandra could look at me and I could look at her, and it was almost like we could read each other's minds about what the session should look like next or where we should move next with the clients. Like we in and of ourselves developed such a strong way of communicating with each other that the sessions became just so, I don't know, they just had such a beautiful flow to them because we could just look at each other and kind of gesture to each other and like trust that each other's therapeutic judgment was right on. And she taught me a lot about body awareness and autism, core strength, some of the mind body connections in autism that dance therapists think about when they're working with these children. And it was just, yeah, it was really great experience, and I really missed those groups. And I must have really loved it if, as a grad student, I was at MTVC at the time, but waking up and working on a Saturday every Saturday for years, I just loved it so much that, I'd rather be there than go to the beach or whatever else people do on Saturdays in Miami. So
Yeah, it's very rewarding
yeah,
sometimes.
it is.
Okay, so for my next question, we answered this a little bit already,
Yeah.
but where did you study for music therapy?
So I did my bachelor's degree at Montclair State University in New Jersey. It's in the New York, New Jersey metropolitan area. And then for my master's and my PhD, I went to the University of Miami in Florida. And so, yeah, and I stayed there for both my master's and my PhD. So, got a little taste of the Mid-Atlantic region and loved it, and then was able to come back down to the Southeastern region and continue. So.
And then you got your doctorate from
Same thing,
University of
Miami. Yeah.
Mhm.
And at first I didn't intend to get my PhD so quickly after my master's because I wanted more clinical experience before I went back for my PhD. But then I was given a very wonderful opportunity that I just couldn't turn down, which is basically that my teaching assistantship during my doctoral studies for 2 years was a clinical assistantship. So I was at Nicholas Children's Hospital 20 hours a week doing clinical work and then supervising students. So it was kind of like the best of both worlds. I got to reach both of my goals simultaneously, was to get more clinical experience in a area that I didn't have a whole lot of before, and then I got to continue my studies at the same time. So I'm very thankful for that experience and that opportunity that was given to me.
Okay. And then my next question would be, do you have any additional training outside of your MTBC certification?
No, so I thought about that before. I had previously thought about actually before Texas as a job opportunity was a twinkle in my eye. I thought about coming here to get my master's in music therapy and do a counseling degree. So I did have interest in that because of my background in psychiatry. But ultimately, I decided my goal professionally was to really be a music therapist, not to be something else or not to be a counselor who uses music. And so I decided to kind of stay the course um, in music therapy, and I'm glad I did. Although I'm also very thankful that there are other people who have taken other paths as well. I did go through and participate in a neurologic music therapy training back in 2016, and I feel that that has benefited my clinical practice as well. But I did not keep that up. So
Okay. And then one last question just for fun. So we've been doing all these interviews and performances and events for our advocacy week.
yeah.
And I know back at SAM, we have uh, an MT advocacy week in the February.
Mm-hmm.
So is there anything planned for this year or?
Yes. My guess is so the music therapy advocacy or awareness weekend usually is on campus, and it's usually a week of activities and events, and then we have a Friday night coffee house event, and then
Mhm.
Saturday all day. And so with in light of the pandemic, it's highly likely that most of the events, if not all of them, will have to be over Zoom. Although we think that that's going to be a good thing because it means uh, maybe speakers that we would have invited in the past who couldn't make it in person can now Zoom. So we have reached out to some different clinicians and people we have asked to speak on some different topics. And then as far as coffee house goes, it also means that we can potentially have people watch from all over the country. So our parents who don't live nearby or family, friends, and that kind of thing. And luckily, the university has been wonderful with live streaming on Facebook and private live streaming. So we're trying to figure out how making sure we have copyright licenses and that kind of thing if we're going to be performing established music. But we even talked about maybe making Coffee House all originals this year to avoid problems with copyright. And so it may be that it's all original music this year. So definitely stay tuned for that. But I know some of the topics that we are hoping to have presenters about include the neurodiversity movement and autism, music therapy with children with who've experienced abuse and neglect and perhaps are involved in the foster care system. Trying to think. NICU music therapy with premature infants, always a popular topic. So I know that's something we were looking at. I can't remember the other ones, but it's definitely going to be fun. So we'll make sure we advertise it really well once we have it finalized. So
Okay.
yeah,
Well, those are all the questions I had today. I really appreciate you taking the time out of your day to do this interview with me. It was
thank
great.
you. It was awesome.